So the next movement we're going to do is hand over head stretching. Now with this one, this is whenever you have cording or tightness that extends over the elbow joint. So the initial exercises are for the upper arm and are safe to do for all the stretching wherever it is along the length of your arm. But if we have tightness that extends over the elbow joint, we want to add in a little bit more of a stretch so that we can straighten that elbow out. And quite often, whenever you have cording in and over that elbow joint, you get restricted flexion or a restricted bending movement. So with this particular one, what we want to do is we want to keep your elbows as straight as they can, and we want to keep your palms together. So starting off a similar position to before. This time we're going to interlace our fingers together, our palms are going to be touching. Our starting position is where our knees are bent, our feet and our knees are equidistant, about hip width apart. And what you're going to do is you're going to bring your hands up as far as you can above your head. Now the important thing with this is that you want to make sure that you keep your elbows as straight as possible. So if we bring them up, our palms are facing each other and our elbows are straight, and we're going to try and take them as far over our head as we can. Hold for 5 seconds and then come back to a starting position. Now the cheat with this one is where when you move up, you bend your elbows out more. Now that will not achieve a stretch on the cord, so you really want to make sure with this one that your palms are almost super glued together and that you're bringing that movement up to where your limit is. Initially, if the cord is very tight, you might only get up to about here. So you go just to your end of your range of movement where you know if you push it any further it's going to be really uncomfortable. So you go to your end of range, hold it 5 seconds and then ease off. The idea is, like the other stretches, is that the more times that you repeat this, and as the days go on, you gradually will work into that available range and be able to get the full range of movement achieved. Remember, holding 5 seconds at the end of the stretch and then gently coming back down to your starting position. All these stretches, it's slow, controlled, gentle movements and should never have increased pain with the movement. Okay. So the extension for this exercise, hand over head stretching, is similar to the previous one. So with it, we then want the trunk twist. Okay, so what we do is we get into position to start with. We clasp our hands, palms together. Our arms come up above our head. So that's putting the stretch on the cord to your available range. And then you're going to go with the twist. So you want to twist around to your left side, keeping your knees and your feet together. Holding for a count of 5 and then coming up and returning to starting position. Now if you want, you can rotate to the other side as well. But basically what you're wanting to do is whenever you do introduce the rotation of your trunk or moving your legs to the opposite side, you're moving away from the side of your surgery. So my surgical side is my right side, and as an extension to this movement I want to move my legs over to the left. Holding it for a count of 5 and then coming back to the start position. And then just to complete that movement, whenever you've completed 10 on each side or to the affected side, you just bring your arms slowly back down to the start position. You must remember with this one that you stretch the cord first, arms straight, elbows straight, taking it over to get the full stretch in the cord, then rotate the trunk. So you're taking the legs away from your uprated side, holding it for a count of 5, then bringing back up to the centre, and then bringing your arms gently back down to the start position.